Now, the Victorian Premier Daniel Andrews is under fire over the state's health crisis. Following revelations a regional hospital forced expectant mums to travel hours for maternity services. It comes as he flags new rules and changes to restrictions. Here's our Victorian political reporter, Simon Love.
Well, first it was ramping in metropolitan hospitals, then staff shortages across the state, and now there are major issues with maternity services at two regional hospitals here in Victoria. The Nationals member for Lowan, a state electorate in Victoria's far west, Emma Kealy, has revealed that Horsham Hospital has suspended services in its maternity wards. She says people are being told to go to Ballarat, which is a 2-hour drive east, and she blames a merger of health services in the region. But when asked this morning about the case, the Victorian Premier Daniel Andrews said staff shortages and a lack of willingness for people to work in the regions could be behind the temporary issues.
There are pressures and challenges in delivering a full range of services, particularly in regional Victoria. That's very challenging, but I wouldn't want anyone to think that the Portland District Health Service, and I'm sure Horsham as well, the Minister, the Department, staff that are there now, they're all working as hard as they can to recruit, to replace, to backfill.
I saw the Premier today in hard hat, high-vis vest, looking for pats on the back about level crossing removals. How about he fix the health service rather than looking for pats on the back?
Sky News has obtained correspondence from sources close to the hospital which confirms that Wimmera Health has suspended maternity services at the present time, but when contacted this morning, the health service denied this occurred. It comes as labour force figures are released with all eyes on the unemployment rate. Mr Andrews believes that overseas migration may be a solution to the health staff shortages.
You've got to fund health properly. Cutbacks don't help anybody. That was what was so disappointing in the federal budget just a couple of weeks ago, and I'd urge Josh Frydenberg as a Victorian and Scott Morrison, I'd urge them to reconsider that. This is not going to be over in September, so the funding just falling off a cliff.
The Federal Treasurer, Josh Frydenberg, is spruiking the figures while campaigning in Melbourne's southeast.
We have lifted significantly the funding for health right across the board. Well, here in Victoria and across the country.
All of this comes as the Premier was grilled about any further changes to COVID restrictions in Victoria, with cases increasing due to a variety of factors.
The Parliament has given us an act where I don't make those decisions, the Health Minister does, but he'll be out to talk to you soon after that peak has been hit with new set of rules and changes.
It appears the health crisis and the job shortages right across the state may be addressed in Victoria's state budget, which will be handed down next month.